Right, who are you?
Sue Murray, practice nurse.
And before that,
I worked in hospitals.
doing plastics?
I did agency work at Broomfield Hospital, which was burns and plastics. Before that I worked with special needs, and before that I did school nursing. I've been nursing for 25 years.
So a bit of everything.
Bit of everything.
And you're an Essex girl?
Yep.
Right.
Can you tell by my accent?
Well,
Yeah.
the first question was going to be, what are you doing tonight? But I thought,
no,
be
it's
professional.
a bit wet for me, wet still.
Yes.
White stilettos.
All right, so let's have a bit of advice for people who maybe aren't quite as experienced as you. If you were just starting out in general practice, what would be the advice you'd like to be given?
When I started, I was lucky enough to go on a practice nurse apprenticeship scheme that was run by the local PCT, which gave a lot of education without needing to see patients. So I was being taught and working alongside an experienced practice nurse, which was fantastic. Not all PCTs do that, and they're not always available. If you're in general practice now, I think the biggest thing to learn is to say no if you're asked to do something that you don't feel that you're qualified to do or experienced enough to do. It's okay to say no. The GPs...
Even to the GP?
Yes, well, yeah, I think you have to. And I think if you can say no because you're not experienced, if you're worried about doing something, then you have to say no. Your own registration would be at risk if you didn't. And GPs will then have to put you forward for training so that you can then learn how to do something properly.
Now, I don't think everybody else would have your sort of oomph. I find you quite intimidating at times.
I do try to intimidate you.
Yes.
but
I mean, if I was a word of criticism, I think that could go a step further. I think there could be just a little bit of corporal punishment thrown in just now and again when I've been a very, very, very naughty boy.
I'll try my best.
But,
it is hard. If you're not as bolshy as I am, and a GP is asking you to do something that you're not prepared to do, that you don't feel you've got the experience to do, then talk to another peer group. There is practice nurse groups right throughout this area, right throughout Essex. Our local one's called Seeping, which is the South East Essex practice nurse group. You can talk to them.
A pleasant name.
They're Seeping. But it's a peer group. Also through most of the management systems, whether you're using System 1, Phoenix, there are emails to other nurses in other surgeries. Talk to another nurse. Ask for help, ring the PCT, ask for their education department, talk to somebody there, because you're not on your own.
Get a bit of backup.
Get some backup.
Okay. All right. Now, you've also had a bit of experience of management, haven't you? You sort of wheel and deal and organise things. I sort of find you just sort of grasping the reins and running with things, where other people would perhaps just say, well, I'm a clinician and that's my job.
One of the other surgeries that I work for, the practice manager had never managed before, so she was very new. So when I got involved with things that most practice nurses didn't get involved with, running audits, making sure we were hitting QOF targets, setting goals, devising patient group directives within the surgery, things like that, to make sure the job was done.
Good. So if you, let's say a nurse was in a practice where they weren't doing particularly well with regards to QOF, would you have any words of wisdom for her or them?
If every time you see a patient, you make sure that within the last 9 months a blood pressure's been done, the body mass index is recorded, their height, weight, smoking, and giving smoking advice, that kind of thing. If that is always done to every patient, if it hasn't been done in the last 9 months, your practice will gain in points. Those kind of things are routine, very easy for any nurse to do at any level, or healthcare assistant, and that will boost the points of the practice.
And it must go on the screen? It's
got to be recorded. If it's not recorded, you're not covered. There's nothing to say that you saw that patient and this was done. You know, getting it on the computer, recording it at the time you see the patient is paramount.
Okay, so basically you say that nurses have got to have a bit of initiative if they find themselves in that sort of situation.
At the end of the day, if your practice doesn't get the points, it won't get the money and your wages will depend on it. So not only is it about increasing and making better patient care, it's about making sure the business runs, and they're both important.
Okay, well thank you very much indeed for that. That's great.